All the new cases are mild cases. We also recorded one death, a 49-year-old male from Mbale district, bringing the total cumulative COVID-19 deaths to 20. The cumulative number of confirmed cases of COVID-19 in Uganda is now 2,166. The COVID-19 situation is rapidly changing in Uganda, with intense transmission in Kampala, where Makindye, Nakawa, and Kawempe divisions are the most affected. Today, Uganda has registered the highest number of cases at 318 in a single day. The breakdown of the cases is as follows. Amuru Prisons, 154. We have 150 inmates testing positive and 1 prison staff. Contacts and alerts were 136. Health workers were 20. Truck drivers were 8. Currently, the active cases on admission are in 12 isolation facilities and 1 auxiliary center. All the prisoners, that is 152, are in an auxiliary treatment center. Currently, Kampala metropolitan area has the highest numbers of community transmission. A cumulative total of 540 COVID-19 cases have been reported in Kampala since the 23rd of March 2020. Of these, 342 cases were registered within the last 1 week. This highlights the need to ensure that workplaces strictly observe the standard operating procedures and infection prevention and control measures to limit the spread of COVID-19. Moving forward, government will put in place measures to strictly enforce prevention at both personal and institutional levels. In light of the above, the Ministry of Health undertook further investigations in Amuru prisons. Out of the 205 inmates, 153 inmates tested positive. Out of the 28 prison staff, 1 tested positive. The ministry, working with Uganda Prison Services, has since relocated all the confirmed 152 inmates to Gulu Central Prison, which is acting as an auxiliary isolation facility. The situation, of course, will continue to change and increase if the population don't adhere to the measures. When His Excellency began easing the lockdown, everybody indicated that they would adhere to the preventive measures. It is something that we have not seen at all being followed. We see people in taxis, and we see taxis carrying more than the 6 recommended numbers, and they are not wearing masks. We see overcrowding in the arcades, and people are not wearing masks. There is even no sanitizer, no hand washing facilities. In the markets, people are not wearing masks. There are no hand washing facilities, meaning Ugandans forgot where we came from. And unless we return to our initial determination and commitment to prevent COVID, the numbers will continue to increase.